Hello everyone, I am Jean Emmanuel Rectra, an international student from the Philippines taking up nursing leadership and management at Seneca College. I am here today to reflect on the past week's lessons in nursing informatics and why these lessons in nursing informatics are essential for nurse leaders. In week 2, it is about the definition of nursing informatics and how it differs from health informatics. It also discusses the reasons for nurses needing to have nursing informatics as a foundational skills, the guiding principles that nurses need to follow as it pertains to nursing informatics, and the quality patient safety education that links to nursing informatics. Nursing informatics combines nursing, computer science, and information science to handle medical data and create and maintain data systems that are intended to enhance patient outcomes as well as the healthcare organization's overall performance, while health informatics uses information technology to organize and analyze health records to improve healthcare outcomes. Regardless of the differences in each institution's organizational framework, all organizations believe that all nurses must understand the core guiding principles and nursing informatics well enough to offer safer, higher quality, and better nursing care. Every organization's guiding principles revolve around the patient and the public's safety. Due to the widespread adoption of medical health records, nurses can now access to correct patient information such as the patient's medical history, prescription list, test findings, and physician team notes, and can assess patients more accurately and make better decisions about their care. This demonstrates why nursing informatics is critical for nurses and the overall healthcare organization. In week 3, the lesson was about the common nursing informatic roles in Canada and the nursing informatics guidelines of the Canadian Nurses Association, or the CNA, and of the Canadian Association of Schools of Nursing, or CASN. There are a variety of nursing roles in Canada in the field of informatics. Some of the roles are nurse informaticist, nursing informatics specialist, director or manager of clinical informatics, chief nursing informatics officer, and nurse educator or instructor. Most nursing informatics roles require a bachelor's degree in nursing with an additional certificates. However, if you want to pursue an executive role like being a director or a manager of clinical informatics, he or she needs to take a master's course. It is important to know the nursing informatics roles in Canada so that the nurse may report a problem that may arise to the respective person who designed the system. The Canadian Nurses Association, or the CNA, together with the Canadian Nurses Informatics Association, or the CNIA, has created guiding principles that make nursing informatics support decision-making relevant to the profession's use of information and technology in digitally connected health environments. Nurses in this profession should be literate in computers to be able to keep up with evolving technology. The CNA and the CNIA also believe that standardized terminology should be used in documenting nursing care in the electronic health record in Canada. They also think that having a standardized method for patient assessment will help students and nurses provide high-quality care and keep patients safe. The objectives of the Canadian Association of Schools of Nursing are to foster a national dialogue among nurse educators, informatics experts, and nursing students about incorporating nursing informatics into entry-to-practice competencies, to improve the capacity of Canadian nurse educators to teach nursing informatics, and to engage nursing key stakeholders in developing nursing informatics outcome-based objectives for undergraduate nursing curriculum. A nurse must use pertinent information and expertise to assist in the delivery of evidence-based patient care, which means that he or she knows how to analyze, interpret, and document important nursing data and patient data with the use of standardized terminologies and information and communication technologies, or ICTs, according to the rules and regulations of their workplace. In week 4, the lesson discusses the basic hardware components of a computer and its functions, and why it is important for nurses in the role of nursing informatics to know and understand the functionality of the basic computer and its hardware. The computer's hardware is regarded as the most vital since it cannot function without it. Simply told, if you know how to operate a computer's hardware and each of its functions can simply establish what the problem is if the device stops working. You must be familiar with the computer hardware in order to do basic computer troubleshooting. The computer's memory, or the RAM, is an excellent illustration of this. Memory is required for all programs and applications that run on a computer. It simply will not operate without RAM. Aside from that, if you have RAM, but it lacks the specifications to keep up with the programs being run, the operations will be slowed to a crawl. So when it comes to computer hardware, you must ensure that it is not obsolete, which means that you must have to upgrade based on the type of application you often use. By understanding and studying each computer hardware component, you will be aware of its significance, and if it ever fails, you will be able to execute the necessary troubleshooting procedures. Every piece of hardware is critical to the computer's functionality. The performance of your computer largely depends on how good your hardware is, so be sure that they are always in good working condition. A nurse who has a basic understanding of computers and software has an easier time addressing difficulties. The requirement for appropriate record keeping drove the introduction of computer technology into nursing practice. Electronic health records can be created and accessed using computers. Medical histories, allergies and drug interactions, laboratory reports, and clinical and nurses' notes are all included in these records. Computers make it impossible to access electronic health records anytime and anywhere. Electronic prescriptions help computers decrease prescription mistakes. With the aid of these computers, nurses are able to write ordered prescriptions electronically with decreased mistakes. These errors caused primarily by incorrect dosage readings obtained by the pharmacist and are corrected with electronic prescriptions. Therefore, it is important for nurses to know and understand the parts and functions of a computer. And that's it for today. Thank you.